Hi, I am Timmy Pham, a registered nurse who discusses the implementation of health equity in relation to Aboriginal and Torres Strait Islander people, exploring ways in which we can assist them to provide better health outcomes. To start, we should define health equity. It is the idea that everyone has a fair and just opportunity to be healthy as they can be, through removing barriers such as poverty, discrimination, and powerlessness. In effect, this concept has a strong connection with the Aboriginal and Torres Strait Islander community, where 3 years of historical events such as colonialism, stolen generation, and government policies of assimilation and dispossession causes a broken relationship with Aboriginal people and the journey to have a general healthier outcome. This is highlighted in the general health outcomes of First Nations people in comparison to non-Indigenous, in which the Australian Bureau of Statistics reported that the general life expectancy of Aboriginal and Torres Strait Islander people were 8 years less than non-Indigenous counterparts. Furthermore, the burden of disease amongst the First Nation people is 2.3 times higher than non-Indigenous Australians, with factors such as mental disorders and substance abuse being the main factors contributing to 24% of the disease burden. These health outcomes for Indigenous Australians can be reflected through the inequality in healthcare access, where it is revealed by the Australian Institute of Health and Welfare, in which 30% of Indigenous Australians reported that they required medical attention but did not see a healthcare provider within 12 months of their needs, reflecting the innate health inequity that Indigenous Australians face in their ability to achieve a healthy state is halted by socioeconomic and systematic barriers. These barriers that Indigenous Australians face within the healthcare settings are highlighted in the systemic racism that is present in the healthcare institutions. This is present in clinical settings where a patient's culture is misunderstood or not acknowledged, thus providing care that is not holistic in nature, as it disregards a part of a person's identity. In assisting someone without acknowledging the cultural aspect, it leads to possible mistreatment through acts of discrimination or stereotyping. This health inequity is expanded on by the institutional racism present in the healthcare system, in which most of the medical frameworks are centered around Eurocentric identities, disregarding different cultural identities such as Indigenous Australians. As a result, exacerbating the concern of alienation of Aboriginal and Torres Strait Islander people in healthcare settings, where the ability to achieve proper health equity is challenging through lack of cultural safety because of systemic racism embedded in healthcare settings. As a nurse to implement health equity, it can begin at the point of contact with an Indigenous person, in which, when providing care, it should be done in a way where cultural competency is shown. This necessity is highlighted by the Nurse and Midwifery Board of Australia, where the care provided should be holistic and void of bias and racism against Indigenous Australians, and additionally recognise the cultural aspect regarding community, family, partnership and collaboration when considering health-related actions. Furthermore, nurses can play an active role through collaborating with Aboriginal and Torres Strait Islanders, in which there can be education done regarding culture and the differences in health needs that Indigenous Australians need in comparison to non-Indigenous. As a result of this education, it can foster the ability for nurses to build a therapeutic and cultural conscious relationship with Indigenous Australians, in effect allowing for better care to be provided, thus bridging closer to health equity. As a baseline, incorporating Aboriginal culture into the workspace environments such as framing artworks, flags, and acknowledgement of country to better represent Aboriginal and Torres Strait Islander people, allowing for a safer environment where they do not feel ashamed of their identity. While in regard to action, implementing education to nurses to practice culturally safe is important. Guiding nurses through the diversity and complexity of Aboriginal culture, thus allowing for culturally safe communication while maintaining professional standards of care, hoping to bridge the gap to closer health equity. Thank you.